My name is Dr. Jeff Harris. I'm a psychologist in New Mexico in the southwestern part of the United States. This is Key Strategies Training for Psychotherapy Students, Lesson 8. We're going to be talking about using a multidimensional survey to choose a focal dimension. So hopefully you've seen most of the previous videos. So we started by looking at parallel strategies for exploration and change in lesson 1. Lessons 2 and 3 were based on exploring and changing thoughts using cognitive strategies. Lessons 4 and 5 were actually, this is this is wrong. The 4 and 5 were about exploring and changing feelings, and then lessons 6 and 7 were about exploring and changing actions. We changed the order, so this is an old slide, but nevertheless, today is focused on using a multidimensional survey to choose a focal dimension. So I'm going to review a little bit about what we talked about all the way back in the first lesson. So thoughts or beliefs are cognitive processes that help people perceive, interpret, and assign meaning. Actions are observable behaviors that involve the brain's control of motor activity, and feelings or emotions are affective responses that may be associated with physical sensations. So in the first lesson, I may have said these are not as discrete as we pretend they are sometimes. So for example, thoughts and feelings, the brain may not know the difference between a thought and a feeling. So some people talk about cognitive affective schemes in the brain that include both of those. But for purposes of psychotherapy, it's often helpful to make a distinction between thoughts and feelings and actions. So we've said that maladaptive thoughts, actions, and feelings are highly interactive. So if you have a dysfunctional thought, it is likely to be associated with maladaptive feelings and ineffective actions and so forth. And all the arrows go both ways. So one of the premises that we've been talking about in Key Strategies Training is that you can start with any of these, but it may be most helpful to start where the client wants to start. And so that's the focus today. So maladaptive feelings like hopelessness are often associated with dysfunctional thoughts like I'm a loser, no one would want to date me, and ineffective actions like social isolation and withdrawal. But on the flip side, these things also interact in an adaptive manner. So adaptive feelings like hope and a desire to overcome loneliness are more likely to be associated with functional thoughts like maybe I'll meet someone nice at the party, and effective actions associated with overcoming fears and talking to new people in a social setting. So today we're going to be talking about a multidimensional survey and focal dimensions. So counselors can survey clients' thoughts, feelings, and actions to get a holistic picture of the presenting concern. And part of that holistic concern includes describing what Arnold Lazarus called the firing order. And the firing order describes the interaction between different dimensions. And we'll talk about firing order a little bit later. And when you're looking at the survey, it also may be helpful to look for readiness for change. So if you're familiar with Prochaska and DiClemente's stages of change, where you're looking at pre-contemplation, contemplation, preparation, change, and maintenance, when you're looking at a multidimensional survey, it may be helpful to see which part of the pattern clients are ready to change. So the counselor and client can use collaborative dialogue to establish a focal dimension, but by deciding together which dimension they want to explore and change first. So I want to talk a little bit about collaborative dialogue. In some systems of psychotherapy, the counselor takes on an expert role and says, we're going to start here. And some theories of psychotherapy say you should always start changing one dimension. So if you were trained only in cognitive therapy, you might assume that cognitions should always be the focal dimension and the place where you use to promote change. In key strategies training, as an integrative or unified system, we can talk to our clients and make decisions together. So that's the principle of collaborative dialogue, and using a multidimensional survey to establish a focal dimension is an example of using collaborative dialogue. So to conduct a multidimensional survey, it is often helpful to use a worksheet with 3 circles labeled thoughts, feelings, and actions. So I often, I have a worksheet that I have, and we'll try and make it available the same place that you find these videos. And it already says thoughts, feelings, and actions. But obviously, if it wouldn't be very hard for you to do this by hand, drawing 3 circles and writing the words thoughts, feelings, and actions, or to make one up for your clients. So, so this is a worksheet that we'll use. So I'm going to describe the way I frequently do a multidimensional survey. So as a counselor, I might say, when we describe a problem like depression or anxiety, it is often helpful to describe a pattern that includes thoughts, feelings, and actions. I have a worksheet here with 3 circles. Which dimension would you like to describe first? So my client might say, let's start with feelings. I feel discouraged a lot. Then as a counselor, I'll say, let me write discouraged in the feelings circle. Are there other feelings you would like to include? Client says, I also feel weary, like I can't go on. Okay, I've written down discouraged and weary as feelings related to your depression. So on my worksheet, I write down discouraged and weary in the feelings category. And as you saw, it's often helpful to ask the client which one they want to describe first. If they don't care, if they don't have a preference, many clients find it easier to identify thoughts than feelings. So the next part of the example dialogue is going to the next dimension. Counselor says, which dimension would you like to describe next, actions or thoughts? The client says, let's do thoughts next. The counselor says, okay, when you feel depressed, when you feel weary and discouraged, what are you typically thinking? The client says, I often tell myself that I'm not smart enough to do this job. Counselor says, are there any other thoughts? The client says, just a more general, I'm dumb. Counselor says, okay, I've written those down. I'm not smart enough to do this job and I'm dumb. Client says, that's what I tell myself all day long. So we add that to the worksheet. I'm not smart enough to do this job and I'm dumb. And you can see how the feelings of feeling discouraged and weary would be related to I'm not smart enough to do this job and I'm dumb. But we want to not assume that the thoughts always create the feelings create the thoughts. We want to acknowledge that the arrows can go in any direction, and it may be helpful to talk to the client about how they see the pattern emerging. So here's the next example dialogue. When you feel discouraged and weary and tell yourself you're dumb, how does that impact your actions? Client says, I think I shut down. When I tell myself that I'm not smart enough, I don't think I try very hard. The counselor says, okay, I've written shut down in the action circle. What else? The client says, I think I goof off at work, avoiding the difficult tasks. The client says, I've written down goof off and avoid. Are there other actions you would like to highlight? No, those are the actions I usually do that are related to my depression. So those are added to the worksheet. Shut down, goof off, and avoid difficult tasks. And you can go into more detail. Obviously, for this example, I'm giving you a fairly streamlined version of the dialogue. It could take longer. You could put in more details. But the idea here is to get a sense that a pattern like depression or anxiety or a reaction to trauma or substance abuse, any psychological problem is going to contain these three elements: thoughts, feelings, and actions. And once you've described all three elements, the next thing you can explore is firing order. So the counselor says, now that we've described your thoughts, feelings, and actions, let's see how they are related. It may be helpful to draw arrows on your worksheet. Where do you think the pattern starts? The client says, I think it starts with feeling discouraged about work. Counselor says, and then what happens? The client says, then I start telling myself I'm dumb and I can't do the job. The counselor says, let's draw an arrow from feelings to thoughts. And then where do the actions come from? I think they come equally from my feelings and thoughts. So in this example, we put an arrow from feelings to thoughts. The client feels discouraged and weary, and then puts labels on those sensations or feelings. And the labels they put on why they feel discouraged and weary is, I'm not smart enough to do this job and I'm dumb. So a specific one, it's about the job. A more general one, I'm dumb. And then when we asked about the actions, the client said that they come both from the thoughts and the feelings. So when the client tells themselves that they're not smart enough, when they feel discouraged and weary, then they tend to shut down, they avoid difficult tasks, and goof off at work. So you can see how this pattern is a short map, a thumbnail sketch of the depression. But it's helpful to see how these are interrelated and to see how the client describes it. So this is the collaborative dialogue. And instead of me taking an expert role about this is how they're related, I'm trying to encourage the client to create their own theory of their own depression. So the last step is kind of trying to figure out where to start in the process of exploration and change. So we in key strategies training, we call that a focal dimension. So the counselor might say, now that we've described thoughts, feelings, and actions related to your depression, do you have an idea where we should start? Is there one area where we should focus first? And the client says, I think we should look at my thoughts first. Counselor says, do you have a sense of why that would be most helpful? The client says, I think I start by feeling a little discouraged, but then when I start telling myself how stupid I am, then I get really depressed. So the self-critical thoughts really amplify the depression. Yes, it seems like I'm always criticizing myself. So in this example, again, based on collaborative dialogue, the counselor and the client decide together to start by focusing on thoughts. And you can see the counselor is beginning to introduce some language from cognitive therapy about these thoughts. So the counselor labeled these thoughts as self-critical. So when the client says, I'm dumb and I'm not smart enough to succeed at this job, the counselor is labeling those as self-critical thoughts. And we'll talk about how the self-critical thoughts will lead to feeling discouraged or more discouraged and to avoiding important tasks. Because if you're not smart enough to do the tasks, it may be helpful to avoid them. So after you've decided on a focal dimension, in this case, the client wants to start by looking at their thoughts, then you can collect data. And so usually after I've described a general pattern of depression or anxiety with a client, I'll ask them to collect data during the coming week. So the counselor might say, now that we've described the general pattern of your thoughts, feelings, and actions, I would like you to observe how this pattern occurs throughout the week. Client says, okay, how do I do that? Counselor says, I'm going to give you a few blanks of this worksheet, and I want you to write down your thoughts, feelings, and actions when you are feeling depressed or discouraged. I want you to pay particular attention to the thoughts. try to write down the self-talk that you tell yourself in your mind. This will give us some specific examples to look at next week. We can explore your thoughts and see how they may be contributing to your depression. So by identifying a focal dimension and asking the client to collect data throughout the week, this gives you a link to the exploration skills and then the change skills that we've been talking about in the earlier lessons. So you can work sequentially. Choosing a focal dimension can guide the beginning of treatment. In this case, the client has decided to focus on thoughts first, and so that can guide the beginning of treatment. The choice of a focal dimension allows the counselor to use cognitive, emotion-focused, or behavioral skills that focus on exploration and change. And those are the key strategies that we've highlighted in lessons 2, 3, 4, 5, 6, and 7. So you can, in this case, the counselor and client will be using cognitive exploration strategies that hopefully will lead to cognitive change. But over the time, the focal dimensions may shift and treatment may be able to explore and promote change related to different dimensions. So in the idea of working sequentially, if the first focal dimension is thoughts, then we're going to use cognitive exploration strategies and cognitive change strategies that we learned in lessons 2 and 3. And hopefully that will create, if you have more functional thoughts, that's going to lead to more functional, more adaptive feelings and more effective actions. So if you explored the thought, I'm not smart enough to do this job, that may lead to the idea that there may be other jobs that I'm more suited for. And so it's not the general I'm dumb, but using cognitive exploration skills and using cognitive change skills, the client may conclude this job does not fit my skills. And if you conclude that this job does not fit my skills, you might feel different feelings. You might feel discouraged at working at this job, but not discouraged more generally. And the actions might be to look for a job that fits your skills better. So that's the idea of working sequentially. Let's say you're going to start with cognition, but you might then focus on feelings about hope. Instead of feeling discouraged about this job, the client might feel hopeful that there's another job that'll be a better fit. And then the actions might be to look for a job that fits your skills. And there may be some career counseling in identifying the skills that the client would like to use in another job. And the other option is working interactively. So working sequentially, we're going to work on thoughts first, and then feelings, and then actions may be one way to do it. But you can also work interactively with thoughts, actions, and feelings to promote multidimensional adaptation and change. So you can work in a flexible manner, and you can use different points of clinical leverage with different clients or in response to different situations to the same client. So with this client who's discouraged about work and thinks that they're not smart enough, you might use cognitive strategies, emotion-focused strategies, and action and behavioral strategies in different combinations during different sessions. So that concludes the 8 lessons in key strategies training. This is just an introduction to a broader integrative method. The broader method is called Training in Unified Psychotherapy, and it starts with that same premise of thoughts, feelings, and actions can be adaptive or maladaptive, but training in unified psychotherapy also looks at the broader at external influences that shape thoughts, actions, feelings, and internal influences. So if you're interested in, after you've used these key strategies trainings, if you're interested in a more a broader view of integrative psychotherapy, I hope you might pursue our training in unified psychotherapy. But I'm glad that you've taken the time to watch these videos. This is lesson 8. The last video in the series will be a demonstration of doing a multidimensional survey and establishing a focal dimension. And I'll be doing that the same way I've done the other demonstrations with my colleague Karunakar Rao, portraying a client named Raju. So that'll be the demonstration video for lesson 8. Thanks for watching these videos, and I hope you found them helpful.